Kyle has been a partner of ours for a long time, and we're pleased to have him come and talk a little bit about Trilogy.
I know I'm standing between you and Preston is between you and lunch, so we'll be quick. As Ben said, my name's Kyle Monroe. I'm the president of Trilogy Health Solutions. We're a network of doctors and hospitals in multiple markets around the Midwest. We work with a lot of the employers already in this room to give them better prices and better access to hospitals and doctors. As we've thought about what the things we wanted to talk about today, one of the things that we've been really trying to find more of are ways to connect the clinicians with the employers in doing better ways. We work with a lot of the direct primary care groups that have been talking to you already that are providing high value quality care at subscription-based pricing. One of the challenges that John mentioned in his speech earlier is these things about utilization, access to data, right? And one of the things that we do is we really try and make those things work better, working with the clinicians and working with the TPAs to do that. We also do things in workers' compensation, bundles, right? Anything that really helps to drive down the cost of care for employers. That's, if you take anything else away from this, take that away. Finding ways to lower costs, and I couldn't agree with John more that the way to do that is to pay less. It's not to add more layers in, it's not to add more complexity, it's to pay less. It's that simple. Should be. We've built a new product that I think dovetails really well into all the things that we've talked about over the last few days, right? One-to-one employer DPC contracts are incredibly important, incredibly helpful, but that doesn't work in certain scenarios. What if you have multiple locations? What if you've got a distributed workforce? What if they want more choices than one or two practices? So what we've done is we work with almost every single one of the DPC providers that has presented and talked to you in front of the last couple of days. And they're working with us and now offering all of their services to all of the employers we work with. So think about it like a provider network, right? Access to a broad network, good prices, and choice, right? So we've done the exact same thing in the DPC model, right? And this is a new product we've just started rolling out. We launched it this year. We've got a number of employers who are already signed up and using it and it's continuing to grow. And it solves those two main challenges that John talked about, which is one, utilization. We're helping your employees enroll in a clinic, enroll in the right clinic for them. Does that mean it's closer to their school, closer to their work, right? People have different needs. We're trying to match the needs of the patient with the right primary care provider. That includes things like clinic location, right? Like I said, for my own personal example, my wife and I use DPC, and she uses one that's close to her work, and I use one that's close to mine. And it gives us the optionality and the flexibility that we need. It also allows you to take advantage of all of the things that Ben and John and the physicians that have been up here talk about, right? Closures and gaps to care, more direct savings that come back directly to your plan, right? Better stop-loss renewals. If you're a stop-loss carrier and we haven't talked, I would love to have a conversation with you. Real quick, Trilogy team, where are you at in the room? Raise your hands. So the Trilogy team is in the house. We've got a booth out here. We would love to have a conversation with employer. If you're a DPC provider and we haven't talked to you yet, if we haven't talked to you yet, or you're a stop-loss carrier, and you'd like to figure out, and we'd love to sit down and talk about how we might underwrite this and get this as part of give the employers who are using it credit. This was a study that was released a couple of years ago by Milliman on the impact of DPC to a plan, right? 25% fewer hospital admissions, 50% decrease in ED claims, right? And this was really just to reinforce the things that you're already hearing and how it translates into direct savings for your employers, or for your plan. I'm going to wrap up now. I just want to say thank you again for the time. We'd love to talk with you. Stop at our booth, grab us this afternoon, and hope you've enjoyed the conference, and thanks again.